Hello, I'm Larry Stevens, the Project Director of Maryland Medication Assisted Treatment and Recovery Support, or Maryland Matters. There are many pathways to treatment if you are suffering from opioid use disorder, and you should be aware of all of them to determine which one is right for you. One pathway includes medication-assisted treatment. Decades of research support that opioid addiction is a chronic disease that can be treated effectively with medications, just as medications are effective in treating other chronic conditions such as diabetes and heart disease. There are several medications that can help treat addiction: methadone, buprenorphine or Suboxone, and naltrexone. They are all approved by the Food and Drug Administration and proven to be effective for the treatment of opioid use disorder. When thinking about MAT as a treatment option, consider the following benefits. It's available at outpatient residential treatment settings. It reduces or eliminates cravings. It decreases withdrawal symptoms. It reduces the risk of relapse, and hospitalization is generally not needed.
There are three medications that we use to treat opioid addiction: methadone, buprenorphine, and naltrexone. And they all work slightly differently in the brain, but the effect is the same: to reduce cravings and make people be adherent with treatment. Methadone and buprenorphine block cravings and ease the symptoms of withdrawal. Naltrexone blocks any opioid, so people don't feel any of the effects of any other opioids that they might use or might be in their system.
I came up here to help other individuals combat the disease of addiction, not just opioid use, but every other illicit substance that there is. It's a strenuous process that you must go through, one, unfortunately, that I had to experience, and to give that information back means a lot to me. I tell a lot of individuals I work with, I'm a hope dealer, not a dope dealer.
When the MAT people came in, they gave me information. They explained, like I said before, they shared their experience, strength, and hope with me. Because I didn't think that there was no hope. The MAT program came in and gave me hope. It came in and gave me my life again. Even today now, I thank God that I don't get high. I don't get off on this medication. I get better. And it allows me to live. Today I'm at home. I have a beautiful apartment. I used to survive and fit in. Now I'm living. So, my peer support specialist has changed everything. They changed my thinking. And I didn't think that nothing. I was hopeless. I was helpless. I was useless. I was, at a point in my addiction, I was homeless. And today, I've been giving my life back.
Hi, my name is Cyril Scovins. I'm a counselor at the Turk House. And what I want to talk about today is medication-assisted treatment and when it's done right. We have different ways that it's done, but there's a way when it's done right. And when I talk about this, I'm talking about, they call it MAT, but really it just stands for medication-assisted treatment. So when you look at this and you think about medication-assisted treatment, I compare it to when you go to a doctor for a broken leg. You go to the doctor, they examine it, they put it in a cast. So the doctor examines it, puts it in the cast. You're going to be in the cast for 6 weeks, and then you're going to come back, and we're going to look at it. We're going to check it out, make sure everything's good. If it's healed, we're going to let you go. If it's not, we're going to put it back. So that's the same way that it works when we look at medication-assisted treatment. So you go to the doctor, they give you Suboxone. He says, I'm going to give it to you for 6 weeks, and I'm going to give you 8 milligrams. Real small dose, just to see how it's working. So just like with the person with the cast, you're going to come back in 6 weeks. You're going to ask the doctor. He's going to say, so how's it working? You'll say, well, it's working good or it's not working good. At that point, the doctor may have to increase it to 12 milligrams. So he says, come back in another 6 weeks. We'll take a look at it again. Okay, another 6 weeks in the cast. You're going to go back to the doctor for your Suboxone. He's going to say, okay, you say it's not working. He's going to give you another 6 weeks and he's going to increase it to 12 milligrams. Perfect. You come back in 6 weeks, you look at him, doctor, 12 milligrams is working, I'm able to go to school, I'm back at work, my life is feeling better, I like the 12 milligrams, it's right where I need to be. That's when medication-assisted treatment is working right.
I would say MAT is beneficial because people need to realize that addiction is a disease. And like any disease, it's not always curable by sheer willpower alone. Disease is chemical that affects the brain, and sometimes it takes medication to fix that. And it's very important to view it as an opportunity, that you're not switching to another drug. This is something that'll be controlled by your doctor. You work with your doctor, you work with us, your peer support specialist, and you use that to change your life around. And just like any other medication, it's to help you. What peers do is to they're basically somebody that can be compassionate, who have been there before, who have life experiences that relate to the people that they're going to talk to. They're very non-judgmental. They can come at it from an angle that maybe more clinical folk can't. And it's basically, it's very rewarding to be a peer. I can think of one participant in particular who, when I started out with them, they were at the very bottom of the chain. They were homeless. They had overdosed twice into the hospital. They had no job, and family support had dwindled for various reasons. We started working together, and through getting on MAT treatment and starting to work hard with me and getting back into their family life, they were able to get a job. They were able to reconcile with their family, move back into their grandparents' house, and right now, you know, they're on medication treatment, they have a job, they have a place to live, and in my mind, that's just a full turnaround from where they began, and that's only been about 4 months now, so it's a great thing. I don't think that success would have happened without MAT, at least not as quickly. One thing I always tell people about MAT is that it's not the cure to your addiction. What it does is it gives you time to work on all the things in your life that you need to change. I talk to my clients, my participants, about what I've been through. I'm very open about it with them because I like to think that they would be open with me. And I let them know that, hey, some people don't need this at all. Some people need this for a short time, and some people might need it for the rest of their life. And whatever works best for you is the way that we're willing to try and how we're going to be supportive of going forward.
We use the word stigma associated with addiction, and I think that's a good term. But when we treat people differently because they have an illness or a condition, that's not stigma, that's more discrimination and prejudice. So I think it's very true that individuals with addiction are discriminated against, sometimes by their friends, families, employers, etc.
Don't let the stigmas affect your choice. Do what you feel is right for you, and if you're going to get on it, use it to change your life, to change your habits. And don't let the stigmas determine your decision, because everything works differently for everybody. And I think it's important that people are open, especially with the seriousness of what's going on right now. I think people need to be more open on how to make a change and more willing to work on those changes. The biggest misconception of MAT is that you're just switching the drug you're already on for another drug.
The next question we hear a lot of is that addiction medication is a substitution for not doing heroin and not doing Oxycontins. Okay, substitution. So let's look at substitution. Vitamins are a substitution for the things that our body doesn't produce anymore. We take insulin, a substitute for our bodies not being able to produce insulin. Substitution. So we're taking the medication-assisted treatment to substitute for the things that happen chemically in our brains from using drugs that cause us to now have to use this chemical to soften our recovery, right, as we're going through recovery. It works. Substitution. The next argument we hear about medication-assisted treatment is a person who takes medication-assisted treatment is not in recovery. That's not true.
Give it a chance. Take yourself out of it. Think about your future, what you will want, what you really, really want, you know what I mean? And once you get into recovery, you can just understand the sky's the limit. Dig deep down, you know what I'm saying? And just think the overall picture of what can you really accomplish. And it's not hard, you know, just give it a chance. It takes time. That is just an awesome experience, you know what I'm saying? Just give it a chance. It's an awesome experience. Just give yourself a chance, because you deserve it. Your family deserve it, your daughter, your children deserve it, and your parents deserve it, to see you what God intended for you to be. From the beginning, it was really like not so clear, and it's very, very clear now. It's like it's like a fog has lifted, and Matt has really changed it. You know what I'm saying? When I didn't know what to expect, and it has, you know, went beyond my expectation. This time for me, I've been on medication treatment for 5 months. And this is the longest I ever been on medication treatment. I would have been just jumped out of it. But I feel like this is what's working for me.
I'm not worried about urges. I'm not worried about cravings. I'm not worried about waking up ill. You know, I'm not, even when I do medication assistance, I'm not worried about the next day. For some reason, you know, like I said, my peer advocate specialist just got through to me. And I said, okay, I'll try it. You know, and it's been a life-changing event. My life has been soaring, you know, because I'm able to be a part of life. I'm able to live, you know, without chasing a drug. It's nothing wrong with the problem that we have. It's something wrong with doing something about it, you know. And if you don't believe, just give yourself a break. You know, try it. It works. My life is living proof, you know. Every day I get up, I pray, and I go to the MAT program, and I get the hope and belief that I can do this one day at a time, you know, one day at a time. That's all I can tell the next person. Take it one day at a time, and just give yourself a break and have the faith and believe that it works. If it worked for me, it could work for you.
Research shows that MAT is the treatment of choice for many patients with opioid use disorder. MAT reduces the risk of relapse and death from overdose while improving and enhancing the lives of patients. Managing a chronic disease like diabetes or asthma often involves long-term management with medications to help ease symptoms and help the patient lead a healthy life. Opioid use is no different. Medications to treat opioid use disorder are a safe and effective component of addiction treatment. Maryland Matters hopes that you have a better understanding of your options with MAT. It could improve your treatment and recovery and the quality of your life. The option for medication-assisted treatment is available to you right now. These are the programs that partner with us in providing medication-assisted treatment. Anne Arundel County Department of Health's ODSOS and the Baltimore-Washington Medical Center provide outreach to people who use opioids and overdose survivors. They provide access to peer support specialists, MAT eligibility screening and referrals, methadone maintenance, care by a physician specializing in addiction medicine, opioid overdose response training, and state coordination through the Maryland Recovery Net. Total Health Care's Substance Use Disorder Unit provides addiction services, mental health treatment, family therapy, somatic care, case management, acupuncture, and group and individual counseling services, as well as gender-specific services. On-site space is available to facilitate Narcotics Anonymous meetings and a weekly family support meeting. The peer program is an integral part of services. Weekly activities include clubhouse gatherings, book club meetings, alumni events, and Maryland Matters activities. The Reflective Treatment Center is an opioid maintenance therapy and detoxification facility that has operated since 1969. Reflective provides medication-assisted treatment. It offers individual, group, and family counseling. A diverse group of medical professionals, certified counselors, and peers focus on providing each client with a recovery-oriented system of care services. Daybreak Treatment Center provides medication-assisted and substance abuse treatment to individuals addicted to prescription pain medications, heroin, or both. The program's individual and group counseling sessions address the issues of addiction and support patients in their recovery process. Daybreak is committed to assisting individuals in recovery from opioid addiction in a dignified and respectful manner. Turk House maintains excellence and leadership in the Baltimore recovery community by continuously expanding the scope and effectiveness of its clinical, residential, and vocational services. Turk House aspires to provide comprehensive treatment and a transitional living environment in a home-like setting for people who are chemically dependent.